More than 2.25 million people have now had their first dose of the coronavirus vaccine, which is fantastic. But a recent poll commissioned by the Royal Society for Public Health did find that people from Black, Asian and other minority ethnic backgrounds are much less likely to accept this offer when it is offered for various reasons. And that's despite the fact that we do know that BME communities and people are already suffering far higher COVID death rates throughout the pandemic. It is, of course, everybody's choice to be vaccinated against the virus, but we want to help you make an informed decision with the help of our expert panel, who I'm delighted to welcome to be with us today. For more information on getting vaccinated, our colleagues at Healthier Together have put together a list of frequently asked questions that you can find on their website, and we will share the links in this podcast with you as well. So to start us off then, Genevieve, you're a district nurse working with us in South Gloucestershire, but you've already had the vaccine. What did it involve? How did it feel?
Thank you, Mary. Yeah, I've had my 2 shots of the vaccine actually. What happened during the peak of the pandemic in March, I have to have a risk assessment with my manager. Because of my ethnic background, I came out high. So I was put on the front of the list whenever any vaccine would be approved. And what I did was, as a frontline person, I got the duty to protect my patients and to protect myself and my family and everybody out there. What I did was to follow information on the vaccines that were ruling by then. They were still in the making. So I was getting my information from the right source, from an NHS website and from the Department of Health website to see what was going on with the vaccine. So when the vaccine was approved, I knew it was very safe to go. And I was very, very happy to have it done, because what that means is I get some protection and I can go out there and do my job. I'm still isolating and doing all the lockdown. I still do my COVID test on Tuesdays before going out to work. But that sort of like gives you that assurance that being at the front line there and being from a Black ethnic minority group, your chances of going into hospital or having is just limited. Just knowing that it's good. It gives you reassurance when you go out to work.
That's brilliant, thank you. Amran, you work with the BME communities every day as part of your link worker role. What are the main concerns about the vaccine that you're hearing about? Oh, Amran, you just need to put your microphone on.
Yes, the main concern is about the vaccine they have. Sorry.
It's all right, carry on, as if we just start again with what the main concern is.
Yes, main concern is about the community. They think about if the vaccination is safe. What about if something happening to me after I have vaccinated? Reliability of the vaccination. They also thought that it's COVID denial. They thought it's something is man-made and it's not real. And the other thing is civil liberty invasions, such as they thought is planting a chip by the government that can monitor you. That's how they thinking. And a lot of, rumors around what service, and also the other thing is, and they thought, this is something is man-made and they are not have the confidence to have the vaccination. But I think it's getting better. Today I made 3 vaccination appointments for 3 old people. They denied the first one, but now it's starting.
That's excellent. Thank you very much. Caroline, in your experience as a GP, what issues have you come across when explaining the vaccination process? What's going on from your point of view?
I think that actually for the most part it's been quite positive, the response to the vaccine. Most of the inquiries I get in terms of the vaccination process are actually, how do I make my appointment? When is it going to be my turn to be called? And there's some resources that we'll be putting out about how actually the process is running for Bristol and surrounding areas, that will hopefully answer some of those questions. There are a lot of concerns about people with underlying health conditions, whether that entitles them to sort of have their vaccine sooner. And again, all that information is out there. So most of the conversations I have really are about allaying fears that when it's your turn, it will be clear how you can get your vaccine, but also that we are working in terms of prioritising the people most at need, and that there will be enough vaccine for everybody.
That's really helpful, thank you. Rajeka, you were a clinical lead, or you are a clinical lead on the COVID vaccine trials in Bristol. What is the feedback from those trials in terms of safety? What could we, what do we really know that we can help with these issues and problems that people are having, or concerns?
So I think what's really important to know and remember is that the safety information from these studies has been reviewed very, very carefully by the regulatory authorities who have approved them. We on the ground have taken the safety information and data that we collect very seriously as well. And also into the studies, kind of pausing for safety has been worked in. So some of you will remember when the Oxford vaccine study was paused and it made them news headlines, and that was a pause for safety reasons, when something needed to be investigated. And those pauses, although they may seem alarming, the whole reason is because it's to make sure that they're safe. And the safety follow-up doesn't stop there. As people now get the vaccines, there are mechanisms available for us to keep observing people and do more safety reporting as needed. It's not to say that there aren't side effects that people get from vaccines, and I think it's important to separate those two issues, in that very common side effects are people who get a sore arm, and certainly after these current COVID vaccines, some people will actually get a fever or feel quite unwell for 1 or 2 days, but these aren't necessarily unsafe, they're just side effects that will pass.
Thank you, that's really helpful. Latha, the COVID-19 vaccination is not currently being offered to children and pregnant women. Why is that? Could you help people understand that?
So currently, what our understanding about the COVID-19 as a virus itself is not affecting children and young people as much, and they do not seem to present with severe illnesses or death and undue side effects. So the trials that have been done have not been done in the children, and it's now only just begun. So there's limited information and data for us to start recommendation, and it's being reviewed that those with high risk conditions and other comorbidities, whether they should be offered, and that's part of the ongoing trial. As far as breastfeeding and pregnancy is concerned, again, there is no current evidence to say about the risk or the safety issues with regard to the vaccine, but these have not been trialed in pregnant women, and therefore there is insufficient information at this stage that they should be rolled out routinely to pregnant women. And it is done and discussed on a case-by-case basis based on risk factors, if they've got comorbid conditions like diabetes or hypertension or their maternal age, for example. These are factors taken into consideration about prescribing for individual cases. But breastfeeding, it certainly is allowed to give the vaccine.
That's really helpful. So if people are worried and they're pregnant and they'd like to have it, or they want to talk, the best thing to do is that they talk with their midwives or their doctors, and then they can decide on a one-by-one basis. That's the advice, is it, Latha, at the moment? That's also really helpful for people.
And if they discover that after the vaccine they are pregnant, that's okay. Just inform your clinician, your GP or your midwife, and then you will be given advice what to do after. So it's still okay to continue and consider the second dose after the pregnancy.
That's really helpful. So there's lots of talk about the types of vaccine, aren't there, Rajeka? And I think we've talked about 3 different types people might be hearing that are around in the UK or that are being talked about. As a scientist, would you be able to sort of just explain to us the differences between those and what's actually available at the moment, so people can understand?
So I think the main 2 vaccines that are available at the moment and being rolled out are the vaccine that's been manufactured by AstraZeneca and Oxford, and then the other vaccine that is being manufactured by Pfizer. And those vaccines actually are fairly similar in that they help produce antibody or an immune response against one particular part of the COVID infection, so the spike protein. So they're producing a similar kind of infection. They're both based on genetic material that has been derived from the COVID virus. I mean, the main difference between them is really kind of the additional components that have been put into the vaccine. And those additional components, so in the Oxford vaccine, there is an adenovirus, which is it's a virus that causes colds, but it doesn't cause colds in humans, so it's just there as a carrier, really. And in the Pfizer vaccine, there's a different type of carrier, and these are just there to help make the vaccine work, really. So they're really kind of, I think the key is that they're both very similar and they just have very slight differences.
Yeah, so that probably brings on to the bit I wonder whether Caroline could help us with. We've heard that some people are concerned about allergic reactions. Is there a risk associated with that, and is there a difference between the two vaccines for that? I think that might be helpful for people to understand. What's your views on that, or what's your knowledge on that?
Yeah, so the pauses that Rajeka mentioned earlier in terms of the safety monitoring for the vaccines, one of those was in reaction to 2 healthcare workers having an allergic reaction soon after having the Pfizer vaccine early on when it was rolled out. But what follow-up data has shown is that actually unless you have a history of a specific type of allergic reaction, anaphylaxis, to any ingredient in the Pfizer vaccine, or if you have had an anaphylactic reaction to an unknown medicine or an unknown trigger, then it is safe to have the Pfizer vaccine. So if you have sort of general food allergies that cause simple rashes or tummy upset, anything like that, it is completely safe to still go ahead and have the Pfizer vaccine. It's important to note that actually anaphylaxis is a very rare type of allergic reaction. If it's something you've had in the past, you would know about it. Those are the people who carry EpiPens because it needs medical treatment. It's a medical emergency. So actually the number of people who won't be able to have the Pfizer vaccine is very small. But with all vaccines, anyone who's giving vaccines is trained to recognise allergic reactions, trained to give immediate treatment if it's needed. And so really for the general population, it is safe to have either vaccine, really. There aren't the same cautions around anaphylaxis with the AstraZeneca vaccine. So if you are found to have a history of anaphylaxis, that means you can't have the Pfizer vaccine, then the AstraZeneca vaccine is still an option to you. So you can still get vaccinated.
That's really helpful.
Yeah, it's worth saying that.
Just...
Yeah. I think that situation kind of may change because obviously people who do have anaphylaxis have other vaccines without any problem. So anaphylaxis per se is not a reason not to have a vaccine.
Yeah, that's really helpful. And I think what you're saying as well is that any allergic reaction that people have is usually transient and can be dealt with at the time and doesn't last for long. So people don't need to be worried that then makes them ill for a long time. It's just a short-term thing. Obviously it needs to be dealt with, but I think that's what you're saying as well, Caroline, isn't it?
So I think actually reactions to vaccines are common. You will get sort of some irritation at the injection site, a bit of pain, perhaps the fever and feeling unwell that Rajeka mentioned earlier, but we wouldn't class that as an allergic reaction. We would class that as just a vaccine reaction.
Thank you.
And just to add to
that,
just to add to that, I think it's just a component of the vaccine. So sometimes your clinician can then decide which other vaccine you can, between Pfizer or AstraZeneca. So the risk benefit in terms of getting the COVID virus itself, which can cause significant problems and death, I think outweighs the fact that the risk of the vaccine related side effects, which are possibly very minimal. Yeah. So the advice is go for the vaccine, because that will save your life.
Yeah, thank you, Latha. And I think that brings me on to a bit, so you're trained as a vaccinator and you're really encouraging and really want people to get out there and have the vaccine. How do they get appointment if somebody wants the jab? And I think we've already heard about the different cohorts, haven't we? So
yes, I just thought, it was important to make a difference and go out there and do something. So I did all the training and I have become a vaccinator. It gives me a nice positive feeling that I'm doing something useful. And yes, in terms of vaccination, please look up information. You will get the invitation from the NHS directly. And as colleagues and GP colleague Caroline was saying, is no need to ring up our GPs to ask for the appointment, because with government guidance and the committee which has looked at who are the priority groups, depending on vaccine supplies as well, there has been gradations on who will be given. So it's starting off with the elderly, and also then depending on the next age groups, even whether it is other people who are exposed to viruses, for example, healthcare workers or social care. So again, those are in the priority groups. So accordingly, based on that, weighing the risks and exposure risks, their own individual risks, that's what is taken into consideration. And the invitations are sent directly from NHS. So please be patient. Everybody's working patiently and very tirelessly trying to make sure people get appointments, and make sure you get the first and the second dose. So not just having the first dose, it's important to get the second dose as well if you want to have long-term protection, because the first dose gives you good short-term protection, but we don't know how long that will last. So that's the general advice. Sorry, Mary, you're mute, I think. Sorry, I didn't hear that.
Sorry, Rajeka, did you want to come in there? You've got your hand up. Yeah. Well, you're on mute now as well. Sorry, we're having a mute moment.
Oh no, I just wanted to say it's really nice to hear, Latha, that you have volunteered to be given the vaccine, and that it's a very rewarding thing to do. And there's still more volunteers needed, because there are volunteers needed not just to give the vaccine, but also to support around the vaccination. So it would be great to have more volunteers from all over Bristol, really, particularly from the BME community. It's fairly straightforward. St John Ambulance are doing it, and so it's a lot of it is online as well.
I am actually volunteering through my GP as well, so I will be doing that another weekend or so. So positively, we will have more people working tirelessly to make sure everyone gets vaccinated.
Yeah, lots of people are wanting to help with it. Genevieve and then Caroline, I think you both wanted to come in. And Genevieve, did you want to say something?
Yeah, mine was just to ask a question, because some of my colleagues, they've had their first shot of the vaccine, that's the Pfizer one, and now they are due for their second shot, and it's been postponed. And we're wondering, when we sit in the office, wondering if that is was that a good move for them, or is there any side effect to that, or is there anything else we could do for them to go forward to have their second one, because they're over 3 weeks now. They had their first dose of the vaccine.
I think that was a national decision, wasn't it, Rajeka?
Yes,
do you want to come in there on that? Because I know it was looked at really carefully, wasn't it? And they are going to get the second dose.
Yeah, absolutely.
A longer time delay, aren't they? Yeah,
absolutely. And I think the key priority from public health and trying to get down the rates of the virus is really to get as many people vaccinated as soon as we can. And we know that a single dose has good protection. And what we don't truly know is what happens after 3 weeks. So there is a bit of uncertainty there, but it's unlikely that protection will drop off dramatically. It may be even that the antibody levels increase for some time after that. It just so happens in the clinical trial that was the interval chosen. And we know from other evidence, and particularly the Oxford vaccine study, that the longer the interval between the primary dose and the booster dose, the better the booster response, actually. So it doesn't necessarily mean that it's going to be a worse outcome in terms of your individual protection. But hopefully, if we get everyone to have their first dose, then the rates of virus transmitting are so low that actually, even if you do have a lower protection whilst waiting for your second dose, it matters less. And that's what we need to focus on.
Yes,
Exactly.
and I think
Thank
to just echo what Rajeka said is that I'm in the same boat. I've had my first dose, and I'm happy that I'm to wait until everyone gets at least their first dose, so everybody's in the same boat of getting their primary protection. And these numbers are not just plucked out of air, because these are based on other vaccines that have been similarly trialed for other viruses. So this is based on what our knowledge is of vaccine responses. And bearing in mind, we've managed to get a vaccine within a year, which is outstanding progress of science, isn't it? So we are all testing waters and learning, but that's what it is. But it is good practice, at least, to make sure everybody gets some level of protection. I think that's my feeling.
And there
People
are
will
trials
be getting
planned
their follow-up
as well.
appointment.
Yeah,
Thank
and there
you.
are trials planned actually to be looking at these different dose intervals as well, which are going to be happening quite soon. So we will have the answers, the more detailed answers here.
Thank you.
Okay.
Amran, do you think it's difficult or easy to find information about the vaccine for people? How well do you think we're doing at the moment on that?
Yes, I think, yes, it's difficult. It's not easy because it's a language barrier. Large numbers of Somali community, they illiterate, or even the one is read and write, they are just orally people. They pass the information orally rather than, and also difficulty accessing digital information. And I think there is a lot of news information being shared of social media, like YouTube or WhatsApp. That means is they don't have the right information. But I think at the moment, all the people asking us as a link worker, the people asking us the question is, we try to encourage them. We can have a phone call for the GB, and all the questions they need, they can ask.
They can answer, yeah. So just part of doing this podcast as well, and other things that we want to try and help with, is us all trying to get that information out and find the best ways of doing it.
Nearly 10 years now, I'm working with the, treatment rooms about the vaccination, because Somalis, they had a 4% higher than other people in autism. That means that is a little bit, we give them phobia. But I think all the, that in campaigning we're doing, lot of people, they vaccinated. That means I think they just little bit need more work to put in the, vaccination.
And we need some people to have it, and then more people
all
will
the
feel confident to have it, don't they?
Do that campaigning. We work with the GPs and also practice nurses, and we can have a list and call every week whoever group entitled in that week. And yes, I think we get in the end.
Yeah, brilliant. That's really great. Thank you, Genevieve. I don't know if you wanted to come in, but also as a district nurse, do you want to ask your bit, and then also talk about being a district nurse and why you think it's so important that our key workers get vaccinated too?
Yeah, I just supported what Aram said. Most of the Black community, they find it very difficult to go through, to read. When you go to the Department of Health or an NHS site to look at the documents, to look at, it's pages and pages and pages. I think they don't get around, or they don't want to read it. They need to persevere a little bit. For those of them that can read, they still don't want to do it, because I've got some friends that are still nurses. They rather send you clips of somebody on the YouTube talking about the vaccine with no knowledge of what the vaccine is all about, giving them false information. I don't know if there's a way to simplify information on the pamphlet or a leaflet to give out to people that might help them, because I think that is the main problem. We're getting information from the wrong source, looking at all these clips and talking about what they don't know, and people are listening to it and saying, oh, is this, is that, have you not seen it on the YouTube?
So Caroline has put her hand up, Genevieve. She might want to come in on that point before you talk about Caroline. The other bit. Caroline?
Yes, I think just as Amran and Genevieve, you've said, there is so much false information out there, and I think it is a huge problem that actually that information seems to be reaching people quicker than the facts about the vaccine. So you find yourself sort of having a conversation where immediately the assumed position is that this is a bad vaccine and it will have bad effects and it's not safe for me. But also I'm having conversations with people in my community who are completely literate. They're reading that information, but it's a matter of trust. Unfortunately, it's trust in the government and health authorities, and so I think it's also about hearing more of the reasons why people are hesitant. And I think actually for a large number of people it is just going to be time. It is just going to be seeing more and more people in their community receiving the vaccine, not having adverse effects, and also remembering to take a step back and see that actually the magnitude of the scale of the pandemic that we're in, the number of deaths that we're hearing about day in, day out, it's fine to take it as an individual decision as to whether I want that vaccine in my body or not, but that decision does need to be made in the context of your community. And I think that's something that's important for us to remember as well.
Thank you, Caroline. Latha, I think, or Amran.
Well, keep coming back is affecting my fertility. That is the main thing. The main question.
What, that it affects their fertility? So is that something we can? I don't know whether Rajeka or when you want to answer that. Whether there's anything, is that what people are concerned about?
Yeah, I said you have to ask the GBs. Yeah, you have to. If you need to answer from that question because I can't answer. We can. Make appointment. With you again. Yeah,
there's no evidence to say that vaccines affect your fertility. So I think it's safe to say that and to keep spreading that message.
All right.
It comes back to that information. Latha, did you want to come in?
Just to say for Amran, I think obviously as this has been trials done over the year, there are only certain aspects which have been studied. But as Rajeka said, historically, all these vaccines, they're very similar models, have not shown any negative impact. And that is why I think that's helpful to reassure. And also the worry that these RNA viruses, which are kind of genetic material, will that get incorporated in our bodies? Actually, they're all geared up and modified to get self-destruct mode once they get into your body within a couple of days. And I have had similar queries from my ethnic group as well, from friends and family, both inside this country and outside across the globe. And many of them are actually professionals working in different, like even intensive care. And they know I have an interest in vaccine. I read up all about it. So they've got in touch. And it's if you look at all the evidence, it's very easily informs us that trust is important and trust in these vaccines. And different people have different levels of information they want. So as Amran said, some want it very simplified. And I think we need to have methods through social media, which is more accessible on the TV or WhatsApp groups or YouTube as we're doing now, which will give simple information on basic safety issues and also dispel myths like animal products. I think I was asked that question. So egg, animal products, and that is something that we know it's not there, but it has been spread as a reason for not having the vaccine. So I think it's important that we access the correct resources. And I would say NHS COVID is a very good resource. And we've obviously got the Healthier Together, which is the Bristol, North Somerset and South Gloss kind of focused. But the questions are similar on the NHS website. And there are also some who are professionals, but perhaps not specialists in infectious disease like Rajeka. So they might want to ask questions about, how does it affect us? And again, I signpost them to the Green Book. So I've had a colleague text me before and said, I have had antibiotics yesterday. Should I be allowed to go for vaccine tomorrow? And I told her it is absolutely fine to go, but if you want to look up this website. And she was absolutely happy.
Thank you, Latha. So I think we'll come on to some resources at the end when we conclude, because it might be good just to sort of pull that together where people can go and what places are. But Genevieve, do you want to just, you briefly said it at the beginning, why you think as a key worker, as a district nurse, it's so important for you and your colleagues to have the vaccine. You just tell me why do you think it's important? If colleagues are listening who are working in Sirona or other health services, why should they have the vaccine?
Because we are the frontline workers. We've made vulnerable patients day in, day out. So it's very, very, very important that we protect ourselves. And by protecting ourselves, we protect them. What we're trying to do in the community is to avoid hospital admissions. So if we're not protecting ourselves by having the vaccine or taking measures to reduce this infection, they're all going to end up in the hospital, and you know what is happening in the hospitals now. So that is why it's very, very important for the frontliners to have that. But having said that, most of the people that I work with like with a white community in where I work. So I am appealing to the Black community in the front line. Please, they should. The gain outweighs the risk. They should go and have themselves vaccinated, protect their family. I'll always say that, to protect their family, protect themselves, and protect the patients that we care for. That's my message.
That's really clear, Genevieve, a really clear message. Thank you. So my final question, I think we're coming to sort of pulling everything together now. It's been a really good conversation. Thank you, everybody. Is how did you get your information to make an informed decision about getting vaccinated? What would you say to people who are looking for further guidance? So, Caroline, can I come to you first for that?
Yeah. I guess in my job, a lot of, for everything, we have to stay up to date. We've got to be constantly learning. So a lot of my resources actually came from things like the Royal College of GPs, NHS England, but actually a lot of the information that I've gone to when I'm trying to explain more about the vaccine to others is freely available. So things like the NHS website, Latha mentioned the BNSSG Healthier Together website, which is excellent really, because not just does it have the information about the vaccine, the safety, but also it gives you the logistics of how it's going to be rolled out in your area. So I think that's a fantastic resource as well.
Thanks, Caroline. Genevieve?
Yeah, it's the same, but just the same back what Caroline said. Just go back to the sources, and like we said, Department of Health and NHS. You could call your GP if you're not sure to talk to them. They can talk to us. The patients do ask us because we do see them face to face, one-on-one. At times, we're just the only people they see in a week. So we try and get as much information as we could and to talk to them. And what we don't have in depth, we refer them to the GP or refer them to the right source. That's their family, to speak to them and get that information. And I must say that all our patients they are very good and they are keen and willing to have it. Like I just said, a mainly white community. So we don't have problem with them. It's our community that we have problem with. And that's the people, when they send me all these YouTube clips of somebody talking about the vaccine that they done, I try to call them to try and put a stop to it. Stop spreading them. Stop sending them. Ask if
That's
you.
a really clear message.
Yes.
Yeah, thank you. Amran, what about you? Where have you getting your information from? Make a decision. What would you say to people for looking for further guidance, or for whether they're making a decision about to have it or not?
Yes, I think I got my information via works like Sirona, and also without further advice and assurance for my colleagues who are some medical professionals, such as GPs, asking them to clarify any concerns they had. Then, for example, me, I just in a couple of weeks I make my appointment, but I didn't have yet because I had warfarin, and they said they need to have the last blood test INR, and after that I got appointment now next Friday 29. And
Excellent.
Also my patient, I know I can direct them to the GP and they talk to them, because I know they can't trust in the to write or read other things it's good they talk to the, I think, and also we need to speak to the Moses, I think. That is the best place. They can get the information. And I think, I think now I can see already they can a lot of people willing to have the injection.
Willing to have, that's good. So it's about building trust. That's quite a theme.
Yeah, and also they need to see, I think, 1,800 died yesterday. That's why the two people I calling them today, they said, okay, we can. I said, what do you think? You can go to the Times session or you can have your vaccination because it's protection. And I said, the government is paying a lot of money. Don't listen to the rumors. If you need more information, talk to your GB. And they both said, yes, we can come. Just make that appointment. I think, now they understand. So many people dying.
Yeah, it's terrible. It is terrible.
Yeah.
Latha, have you got some closing words of encouragement to people, or what your views would be?
Well, I completely echo what everyone has said. And Amran, I thank you for sharing all the concerns which people have. And I think it's important to recognize those are natural fears which people have because it is a dangerous virus. And when last week when I was on annual leave and I saw the death rate had gone up to 1,500 or 1,600, and I thought, well, I'm telling people take the vaccine, the risks and the gains far outweigh. And we know the vaccine is preventing serious death and serious mortality and other problems in the hospitals, and our hospitals are stretched. I thought I want to make a difference, so I decided I'm going to train as a vaccinator. And as a BAME person, if I'm actually sitting there vaccinating, that actually sends a different message as well, that if I'm considering it's safe to give, and I've had it. So my message would be that do not rely on myths which are cascaded. So if you do see WhatsApp messages which are going around, I immediately reply saying, please, can we not share this because this is not evidence-based. We all need to take that responsibility and actually signpost to appropriate resources, which is the NHS websites, the COVID websites, which are simple to read, hopefully, and hopefully we can have more people getting vaccinated.
Thanks, Latha. And last but not by no means least, Rajeka, have you got some final words you'd like to bring to the party?
Yeah. I mean, so partly to echo what everything is said already, and also to say, it is difficult just to get your information from reading something that is, not particularly engaging, and so that there is one resource that I'm aware of, and actually this was a resource made to try and explore reasons why people in the BME community weren't coming forward to take part in vaccine studies, but how it's been done is really through storytelling. So it's kind of all these kind of concerns that are very, very natural because we all want to know kind of more. They've already been explored, and some of these videos have been translated now into Urdu and Punjabi and Bengali as well. So I'll share that link, and they're just very kind of easy to watch, but they're things that we can all kind of relate to. So that it's just not you thinking about these things. And to get some of those answers too. Maybe I know really recognise that we need to do more work on how we present that information and have those conversations and translate things appropriately, orally as well as on paper.
Thank you very much, and a huge thank you to all of you for joining me for this podcast, and for those people watching it, thank you for joining us all for our podcast episode talking about the coronavirus vaccine. We will share a list on our website, on the Sirona Care and Health website, and in the description below this video on YouTube of official organisations who can offer support, of some of the resources that have been referred to and that we're talking about, so that we can offer more advice on support on all the topics that we've discussed. As always, please share this episode with your friends and family. Thank you so much for watching, and stay safe.